We know variants of concern are driving up COVID cases in our province. Health officials warning that younger people are getting sick now. Last week, we were told that of the 10 people most recently admitted to the ICU in Regina, 5 of them were younger than 40. Some people can tune it out, but not those on the front line. Joining me now is Dr. Jeff Betcher. He's the critical care lead for the Regina area. Thanks for being here.
Well, thanks for having me.
Dr. Betcher, we've heard a lot about Saskatchewan's hospital situation. Tell me about what it's like in Regina's ICUs.
Right now, all of our COVID patients that are in the ICU are at the general hospital, where we have 2 ICUs, 10 beds each. One's a medical unit and one is a surgical unit, which would deal with obviously medical patients and surgical patients post-op. That goes back to before the pandemic. Today, as of today, we have 20 COVID patients, or 21 COVID patients this morning, in the intensive care units at Regina General Hospital. So we've used up 100% of our beds in the ICU at the General Hospital, and we've had to put patients in other areas and other beds, such as the coronary care unit, at the General Hospital, and at the medical surveillance unit, at the Pascal Hospital, in addition to our 7 ICU beds at the Pascal Hospital, in order to accommodate these extra patients. And the patients that we get that have COVID, to go back to our typical average length of stay for an ICU patient would be 2 or 3 days, maybe 4 days on average, and some of them are longer, some of them shorter. The COVID patients generally stay for weeks rather than days, and so when they get in the ICU, they're going to be there for a long time. So we've got 2 ICUs essentially that are full with COVID patients.
How have the patients changed over the last little while? I know that we had a very different COVID patient in ICU than you're dealing with today.
Well, I think if you look at a year ago when this first started, and it was about a year ago that we had our first COVID patient in the ICU at the General Hospital. Generally, they were older patients, 60s, 70s, some 80s, had the odd 90s. That would end up in the ICU, and we'd look after them there. Today, our youngest patient is in the late 20s, and our oldest patient is actually in the mid 70s. So we've got a whole range of patients that are now in that late 20s to early mid 70s, largely 30, 40s, 50-year-olds, people who would otherwise be out working, otherwise out making a living, out supporting their families, out helping everything that we do in our economy help living productive lives. Now their lives have come to a sudden halt due to COVID. And what we're seeing is this is a long-term disease. This isn't just a typical thing that comes, for a couple of weeks and then you're back on your feet again. Most of the people I would say that we've sent out of the ICU are in this for a very long time, and they're not going to be going back to work next week or next month. They're going to be on a long recovery.
As you say that, are there any cases that really stand out in your memory that you can share without breaking HIPAA rules?
I don't know if I could say there's any one particular case that stands out. I think what's heartbreaking is that now and then someone will identify that they were the one that gave it to their loved one, that spread it to their loved one, or was part of that sort of chain of events that led to their loved one getting COVID, from which they're very sick. And just seeing them struggle with the guilt of that is I think that's probably one of the more heartbreaking things that I've seen.
All that said, what keeps you and your teams going?
That's a good question. I guess this is just what we do. It's just we've given of ourselves to meet and to help those that need help, and that's the only way that I can think of it that keeps me going. Is just, and I'm sure everyone. It's all that we can do to help out.
Dr. Betcher, thanks so much for your time and for your work.
Thank you very much.
Jeff Betcher is the Saskatchewan Health Authority's critical care lead for the Regina area.